Greetings, my name is Mallory Cotton, and today I am pleased to present to you our newest client, Jack. I will provide an overview of my biopsychosocial assessment along with my diagnostic impression and a suggested treatment plan and medication for this client. So let's begin. Our client is a 60-year-old white male. He is of average height and weight and appears to be older than his stated age. The client is reported to appear depressed upon his presentation to the chemical dependency unit. He has no significant medical history reported and no direct signs of cirrhosis of the liver. He does complain of stomach cramping but denies any known allergies. He does deny having a seizure disorder. However, in the past year, he suffered a seizure as a result of his substance use and was treated for that medically. He reports that when he does not drink, he experiences shakes, sweats, and vomiting, and frequently sees blood in the vomit. Our client states that he has been feeling depressed for an unknown amount of time and has no history of suicide attempts. However, he does endorse some suicidal ideation and states that he, quotes, wishes he was dead, and if he owned a gun, he would, quote, shoot himself. He denies having a concrete plan and does not have access to weapons. He also denies any hallucinations of any sort. Our client has a family history of substance use in his birth father. He reported that his parents divorced shortly after his birth, and his birth father was not active in his life. His birth father later died from complications of alcohol intake throughout his life. His mother remarried, and the man she married and stayed married to for 20 years was in the military, causing the family to move frequently. The client has 2 half-brothers and 2 half-sisters, all of whom he is not close with. However, he was close with one brother who passed away as a result of cancer recently. The client reports that his birth father, as well as one of his brothers, has a history of substance use, alcohol specifically, and that they have never sought treatment. He denies any knowledge of mental illness in his family. Our client is currently married. He had one marriage prior that ended in divorce. In this current marriage, they have been reported to be separated off and on over the past year. The client reports this as a result of his substance use. He stated that he and his wife fight frequently secondary to the substance use, and that the client frequently prioritizes purchasing alcohol over groceries. As a result, his wife kicked him out of their home, and the patient currently does not have anywhere to stay, as the friend he was residing with also asked him to leave the residence. The client disclosed some domestic violence, stating that he has pushed his wife on a few occasions while he's drinking alcohol, but denies any further violence or slapping. He is experiencing sexual difficulties as a result of his drinking, which has also impacted his relationship. The client has very little supports in his life. Being separated from his wife, who was his main support, and the friend asking him to leave the home has put strain on that relationship. Our client was in the Army and worked as an assembler and was promoted to a higher rank position in operations management. Following that, he was able to obtain his bachelor's degree and then his chiropractor's degree in 1990. He opened his own private practice for chiropractic and was quite successful until his substance use became too much of an issue. He then lost his practice and incurred a malpractice suit. He is currently unemployed and has sporadic income through odd jobs. He is not currently seeking actively seeking employment at this time. He has an extensive legal history, secondary to his substance use. He's currently facing charges for reckless driving, reckless endangerment, and driving without a license, as his license was suspended. Due to the malpractice suit that is pending, he could also lose his chiropractor's license. For the client's substance use history, he reports that he drinks alcohol all day long, and he came into the unit with a .23 blood alcohol level and also tested positive for marijuana, which he states he uses for insomnia. He reports that he's had ongoing difficulties with substance use in the past 10 years, but that it's gotten worse in the last 2 years. He reports that he drinks approximately a case of beer and at least a pint of vodka daily, and endorses spending in excess of $200 weekly on drugs and alcohol. He has a history of outpatient chemical dependency treatment with at least 3 detoxification admissions, and has attempted to maintain sobriety in the past through Alcoholics Anonymous support groups. Based on these signs and symptoms, I have my diagnostic impression for this client is alcohol use disorder, severe, with a secondary alternative diagnostic impression of substance-induced depressive disorder. For further evaluation, I recommend that we use the CAGE screening tool as well as the alcohol use disorders identification tool. For our client's treatment plan, I recommend that the overall goal be the client will maintain abstinence from alcohol through the use of coping skills and relapse prevention planning. We will achieve this goal utilizing cognitive behavioral therapy. Our first objective in this treatment plan would be as follows. The client will develop and practice alternative coping skills with guidance from the therapist during a once weekly counseling session to be held on Fridays at 10 a.m. for 12 weeks. The treatment tasks for this objective would be the client will self-monitor individual urges to use alcohol. The client will practice cognitive reframing as described by the therapist through role-playing. And the client will explore the pros and cons of continued alcohol use. Our second objective would be as follows. The client will participate in the development of a relapse prevention plan every Friday from 10 a.m. to 11 a.m. for 6 weeks. With the tasks being, the client will identify high-risk situations in which relapse is more likely. The therapist will educate the client on the relapse process and the abstinence violation effect. And the client will be able to identify and demonstrate tools to manage a lapse as taught by the therapist. 2 medications that I recommend be considered for our client after he has completed detoxification from the alcohol are naltrexone, which is an opiate receptor antagonist, which will prevent the rewarding effects of alcohol and reduce the craving for alcohol, and naltrexone at 50 milligrams and disulfiram at 250 milligrams. Disulfiram assists already abstinent alcoholics in resisting alcohol consumption and actually will cause the individual to become ill if they do consume. The challenge with disulfiram is that it's only successful so long as the client is taking it regularly. These are my assessments and recommendations on our client Jack. I hope you take them into consideration as we look at him and work with him further. Thank you and have a great day.